This week brings significant developments in the COVID pandemic. The World Health Organization has now declared that the global health emergency is over.
Later this week, our nation's health emergency will end. But what does this all mean for you? Jerry Carnes with our Verified team here to check out not only, how this would impact our health, but also our wallets.
And it will indeed. A little more than 3 years after the World Health Organization called the coronavirus pandemic an international crisis, the director of the WHO says COVID-19 continues to be a global health threat. The public health emergency is ending, and that will change our nation's approach to COVID-19. About 81% of all Americans have received at least one dose of the COVID-19 vaccine. According to Atlanta's Centers for Disease Control, about 70% are fully vaccinated. According to the CDC, for the most part, access to vaccines will not be impacted, at least for now. The Department of Health and Human Services says it is committed to maximizing access to COVID vaccines, and many insurance plans must continue to cover the cost. Will Americans continue to receive free COVID tests? According to the Department of Labor, the answer is generally no. Insurance companies can, but will no longer be required to cover the cost of testing, including over-the-counter at-home tests. Will the end of the public health emergency impact the cost of COVID-19 medication? According to the CDC, the answer is yes. Thanks to federal funding, medications such as Paxlovid, developed to prevent illness from COVID-19 from turning severe, have been free. The CDC says that will continue as long as supplies last. After that, the price will be determined by the manufacturer and your insurance company. Medicaid will continue to cover the cost of COVID-19 treatments through September of next year. After that, the cost will vary from state to state. Aisha.